So we want to be able to give a true definition of what addiction is, so that our patients understand what this illness is. It's not I'm bad and I use drugs and alcohol. No, there's a biopsychosocial problem within my brain that does not allow me to make good choices once I start using. And those pathways have been altered 50% by genetics. And then culture, environment have an impact on those. Trauma has an impact on those, such that if I get in contact with substances or alcohol again, it throws my life in shambles. Can they control it? Once they use them, we try to help them control it before, to make choices so that they prevent themselves from using it. However, the adaptations that they have in their brains make it difficult to cope with things other than what their brains have learned. So what they're trying to do is survive in their stressors by doing what they think works and helps them to survive. Not to thrive, but to survive. Okay. We've recognized areas of the brain that are involved: nucleus accumbens, anterior cingulate cortex, frontal lobe, amygdala. We've known all this. We're still learning how all this plays into addiction and with exposure to substances. The cool thing about this is we're still learning about this whole field. Brain disease is still developing. We're still learning about how this works. We see the application of it every day. Understanding exactly what's happening on a neurochemical pathway level is what we're still finalizing in. But all of us can say, well, when this person uses, bad things happen. We could even group things together, right? We know that if someone uses alcohol, there's a high probability that the next drug they're going to use is going to be what? Opiates. And one that might follow or be around there somewhere is going to be methamphetamines. Well, why? They're all dopamine related. So I can look at them and say, okay, so somewhere in this person's brain, there's a problem with dopamine and its ability to regulate itself or to be regulated. We know that in alcoholism, there's a genetic predisposition to have lower levels of dopamine, such that when they drink, endorphins are created and go to the opiate receptor and release dopamine. That's the initial buzz they get when they drink. And it's so high from what their baseline is, that's what hooks them. So maybe this is what's happening with opiate addicts. Maybe they have a lower level of dopamine at a basic level, therefore they don't receive pleasure in normal things, and they're chronically depressed and down. And when they use, they feel normal for a bit. I hear people say the sky was blue, and just, wow, I had energy, I actually felt normal. And then it's kind of off the tracks.